My name is Cully Carson. I'm professor of urology at the University of North Carolina at Chapel Hill in the United States of America. Testosterone is widely used for men that have low testosterone, and it's widely effective for those men and changes their lives. It improves their energy, strength, and ability to have sexual function. But there's some issues with regard to safety in addition to the efficacy. And the safety issues come in two varieties. Number one is cardiovascular safety. Number two is prostate safety. Cardiovascular safety is an area of significant controversy in 2015, and indeed the Food and Drug Administration in the U.S. has come out against using testosterone in elderly men in general just because of concerns about cardiovascular function. On the other side of that, however, new data are coming out, and new data have been published very recently that show that not only is testosterone safe for cardiovascular disease in elderly men, but it actually improves cardiac function in some of these men. So while the weight of the evidence is still unclear, it appears that there is a significant safety margin for the treatment of men with low testosterone in the elderly age group. The other part is prostate issues and prostate effects of testosterone. We all know that the prostate grows with testosterone and needs testosterone for size, for maturity, and for function. But there's a misconception. In fact, the conventional wisdom is that if you give extra testosterone, it will cause prostate cancer. Indeed, that doesn't happen. That's conventional wisdom that's in error. There is no evidence, there is no scientific evidence whatsoever that prostate cancer is caused by testosterone replacement therapy. It may cause the prostate to grow just a little bit if the testosterone was very low, but it also doesn't cause patients to have difficulty passing their urine. Indeed, there are new data that show that men that are very deficient in testosterone who replace their testosterone will have an improvement in their urination. So basically, testosterone replacement therapy is effective. It helps many men. And not only that, it appears to be safe both on the cardiovascular front as well as far as prostate function and prostate cancer is concerned.